Hi, I'm Ruby.
And I'm Georgia.
I'm Erin.
And I'm Lauren.
And we're here to discuss with you the implications, indications, rationales, and ethical aspects of introducing seclusion into the mental health environment. Okay, Georgia, so can you please elaborate on what seclusion is?
So, seclusion is the involuntary confinement of an individual in a locked room or area that has appropriate monitoring equipment to adequately assess the state of the individual's mental and physical status, in which they are unable to exit as they wish. Seclusion is used as an intervention assisting in the treatment of mental health disorders.
Okay, now Lauren, would you be able to discuss with us why we might use seclusion and when it might be appropriate in a mental health setting?
Sure can, Ruby. Seclusion is used to provide safety for the patient and other individuals and healthcare staff, along with providing a therapeutic environment. The removal of the upset, uncontrolled and disruptive patient allows for a healthier and calmer environment for the other patients. This intervention must be necessary to be applied. Seclusion is used as a last resort intervention when there is no less restrictive way of ensuring the safety of a patient and others. Seclusion allows for an individual to be given the opportunity to regain their physical, emotional self-control, calming them down and allowing for a more productive headspace to be met. Overall, seclusion decreases the stimulation of an individual, provides privacy, and increases the safety of individuals and other residents. However, it is relevant to mention that seclusion is a safety procedure that is commonly used as a last resort and not a treatment intervention.
Okay, Erin, so how is the room set up?
The room in which seclusion is undertaken is a controlled low stimuli environment entailing only a fixed bed and a mattress and a small security window or camera for direct visual monitoring.
Okay, and so what are the indications for the use of seclusion?
It's about safety of the patient. They may be attempting to self-harm or are aggressive. It can also be used as a relaxation technique by creating an environment free of sensory stimuli, allowing the patient to regain control. Some time spent in confinement also help to maintain the rehabilitative environment and ensure the safety of others and society, including medical staff, family, and other patients. It's important also to recognise and acknowledge that a registered psychiatrist can order the individual to be introduced into seclusion under the belief that this will improve the patient's condition.
Okay, thanks, Erin. Okay, now Georgia, what specific mental illness can we use seclusion to treat?
So, seclusion is used to minimise symptoms associated with bipolar, schizophrenia, manic disorders, and aggression.
Okay, so how does the use of seclusion benefit the patient and their rehabilitation?
So it benefits the patient as it controls agitation and disorientation. It allows them privacy to regain their emotional and physical control.
Okay, thanks, Georgia. Okay, Lauren, so can you go over with us some of the requirements of the nurse in secluding a patient in the mental health care setting, please?
Certainly. Frequent observations must be documented by the appropriate healthcare worker at a minimum of every 10 minutes while in seclusion. These include the patient's behaviour and general conditioning, acknowledging all aspects of holistic health, both mental and physical. 2 hourly assessments should occur to assess the physical well-being of the patient and ensure their safety, along with 8 hourly interactions and care must be undertaken, including tending to the individual's physical needs such as hydration and nutrition, as well as providing appropriate nursing care to maximise the patient's recovery.
Okay, so it's important also to understand that there are legal requirements in undertaking seclusion. The Mental Health Act states that seclusion must be authorised by a psychiatrist or consent administered by a medical practitioner or senior registered nurse in an emergency situation. Seclusion is only appropriate for a person who is receiving care from a mental health service at a registered facility and after all reasonable and less restrictive options have been attempted and considered or found unsuitable. Seclusion must only be used when it is necessary to prevent serious injury or imminent harm to the person or another person. When the individual is placed in a confined area, a safeguard must be present. This person ensures the safety of the patient and that the patient's needs are met, including providing appropriate bedding, clothing, nutrition, hydration, hygiene, and toileting arrangements, along with ensuring that the patient's dignity is met and protected.
Thank you, Ruby. It is also required that the individual that is present in seclusion must be reviewed by a registered nurse every 15 minutes, along with an examination via a medical practitioner, for example, the admitting psychiatrist, every 4 hours. Patient confidentiality must be adhered to. The sharing of the patient's information must not be done unless consent has been given and it is of benefit to the patient.
In summary, it is important that the nurse ensures that the patient's dignity is upheld and safety is paramount while undertaking the process of rehabilitative seclusion.
We would also like to acknowledge, where possible, the use of seclusion should be avoided. Seclusion should be used as the last resort.
However, where appropriate, the use of seclusion can be restorative and beneficial practice in individualising care for mental health patients.
We hope this presentation has been both educational and beneficial to you and will help increase awareness on the use of seclusion as an intervention within the mental health setting. Thank you for watching.